So my experience as a patient was deeply humbling, and it taught me the value of having my own GP and surrendering to any treatment plan that you decide upon with your doctor. So the way it played out was I had two children very close together, and shortly after my second child, my son, was born, I became quite ill. I started to become very tired and developed pain in the tummy, and it was fairly clearly related to my right ovary. And I was very busy working and raising these children, and I decided in typical doctor fashion to self-diagnose and self-manage. So I went off and found time to go and get myself an ultrasound, but I didn't find time to go and find a GP. So I got an ultrasound that showed a cyst on the ovary, and it looked benign, so everyone relaxed. And I kept going about my business, living in the same way that I had. And the pains in my belly got worse. I got another ultrasound and the cyst was bigger. So this time I thought I needed to seek professional advice. So I went to see a gynecologist who worked in the same hospital that I did. And he ordered some blood tests which showed raised levels of the antigen that's a marker for tumours. So he was very concerned that I had ovarian cancer and wanted me to have immediate surgery. And I delayed that for practical reasons. I had these children, it was nearly Christmas. I was going down to be with my parents and wanted, if I was going to have surgery, wanted to go back to my hometown where I had their support and also knew the doctor who'd be operating on me, so I did that. And the operation proceeded, and it was found I didn't have cancer, and I just had sterile inflammation in the pelvis. And I had done a thesis on chlamydia, so I assumed that they had tested for chlamydia because that's the most common cause of sterile PID. And they assumed that I didn't have chlamydia because I just had 2 unplanned pregnancies. So I wasn't tested for chlamydia, and I went home and continued to get sicker and sicker until a few months later a cyst on the ovary ruptured and I developed peritonitis, and that's when the diagnosis was made. So that really taught me how, if you miss steps along the way, you can get yourself into trouble diagnosing and treating yourself as a doctor. And it taught me the value of having a GP. It's so important that we as doctors have a GP that we develop a relationship with, that we don't wait until we get sick, but we have this ongoing relationship with someone we know and trust, so that when things start going a little bit wrong for us, we go and see the doctor. We don't wait till things are catastrophic and then they have to be dealt with all of a sudden. And I feel that that's a lesson that we can all learn, and that it's one thing I would really like to convey is the importance and the value of having a GP that you know and trust in your life.